Hey, good morning, everyone. Welcome here during on this Friday morning meeting here in LA. It is our policy within the BD2K Center to highlight the confidentiality and security of patient information in research at least twice a year, so to ensure the protection of private health information. I will therefore discuss the guidelines that are imposed on working with patient information in clinical and basic research. Now, unfortunately, I will have to reiterate a lot of dry jargon that was also discussed last January, so please bear with me. Um, Aside from financial information, actually medical data is among the most sensitive and most highly regulated information in existence. So in an effort to hold organizations accountable for medical data privacy and to help these organizations to prepare their systems to strategically handle sensitive data, the US government created the Health Information Portability and Accountability Act in 1996, and this is known as HIPAA. So this act set the precedent for protecting medical data, and later in 2009, they created the Health Information Technology for Economic and Clinical Health Act, and this is known as Hitachi. Like I said, we have to go through some HIPAA terminology. The HIPAA Act contains provisions to protect the confidentiality and the security of personally identifiable information that arises in the course of providing healthcare. In order to understand how HIPAA affects research, there are a few important terms that we need to define by the law. First of all, a covered entity is the organization that has to comply with the HIPAA. And in our case, the University of California is a hybrid covered entity because it provides healthcare, it provides education, and it provides research. The HIPAA privacy rule governs protected health information, and from now on I'll refer protected health information as PHI, and which is defined as information that can be linked to a particular person, person identifiable, that arises in the course of providing a healthcare service, education, or research. When PHI is communicated inside a covered entity, let's for instance inside UCLA, this is called the use of information. When PHI is communicated to another person or organization, then this is defined as disclosure. HIPAA allows both use and disclosure of PHI for research purposes, but such use and disclosures have to follow HIPAA guidance and have to be part of a research plan, and that research plan need to be reviewed and approved by an institutional review board known as IRB. We'll discuss all these terms later on. So HIPAA affects only that research which uses, creates, and discloses protected health information. And in general, there are two ways a research study would involve protected health information. First is the study would involve review of medical records as one or the only source of research information. And this would apply to either retrospective or prospective studies that can involve protected health information in this way. The second case is that when a study would create new medical records, when a healthcare service is being performed as part of the research, and this mostly happens in clinical trials. So HIPAA permits the use or disclosure of PHI for research under the following circumstances and conditions. First is if the subject whose PHI is involved in the study has granted specific written permission through an authorization and or informed consent. Second is if the IRB has granted a waiver of the authorization requirement. So a waiver is typical in a case when you would work with discarded clinical materials like typical tissues that are discarded for pathology. If you work with that kind of tissue, then the IRB will typically give a waiver, and the patient do not need to be notified. The third case is if the PHI has been de-identified in accordance with the standard set by HIPAA, and we'll discuss this in greater detail, the de-identification. And the fourth is if the information is released in the form of a limited data set, which is actually being de-identified, with certain identifiers removed and with a data use agreement between the researchers and the covered entity. And this is usually part of an IRB protocol and an IRB review and approval. So in some cases, the HIPAA permits research using PHI without obtaining consent, and this is authorization by HIPAA. HIPAA requires that an established institutional review board reviews the project to be sure it meets all the following criteria. There are 9 criteria here. So first is if there's no more than minimal risk, if the waiver will not adversely affect privacy rights. Third is that the project could not be conducted without a waiver. The project could not be conducted without use of PHI. And also when the privacy risks are reasonable and relative to the anticipated benefits of research. 6 is if there's an adequate plan to protect the identifiers from improper use and disclosure. And also if there's an adequate plan to destroy the identifiers at the earliest opportunity. So meaning that if the study is completed and already published, then there's always a definition when to actually destroy the identifiers. The 8 is when the project plan includes written assurances that the PHI will not be reused, and also whenever appropriate, the subject will be provided with additional pertinent information after participation. So this is actually now the most important slide, and the most interesting, I think, is here are the 18 identifiers in your clinical information that needs to be removed, basically, to de-identify the PHA. And they all make sense, actually. First is the names, all geographic subdivisions smaller than a state. So cities are not allowed to be mentioned. All elements of dates, except for years, telephone numbers, fax numbers, electronic mail address, social security numbers, that makes sense, medical record numbers, health plan beneficiary numbers, account numbers, certificate or license numbers, vehicle identifiers and serial numbers, device identifiers and serial numbers, web universal resource locators, internet protocol addresses, biometric identifiers, finger or voice prints. Of course, full face photographic images are not allowed. And 18, that's a tricky one. It's actually unique identifying numbers. And I highlighted actually a couple of items here. First of all, that I want to highlight the names. What is tricky is we're not allowed to add any initials. I think that's a common mistake, that you add usually initials from your patients or your human subjects into your paperwork, and that's basically not allowed. No initials. Another one is the elements of date. So any surgical or medical procedures, we're not allowed to put any dates there except for years. And number 8 is also a common mistake. The medical record numbers. I've seen people putting in medical record numbers there, and that's also not allowed. So just keep those 3 common mistakes in mind. And then the HIPAA requires that research involving protected health information use a physical or a technical and an administrative safeguard. The physical safeguard actually are itemized here, meaning that storing of person identifier data are locked behind in cabinets, behind locked drawers. Restriction of access only to those project staff who need to access to the files, and paper records should not be kept in areas in which the public may inadvertently see their content. The technical safeguards are that the computers are all, that every computer is encrypted, and that includes the use of a password protected access, screensavers where access is locked after a period of time, and computerized research records should be stored in an encrypted format, as aforementioned. And there's also administrative safeguards, meaning that the use of signed confidentiality agreements and publication of policy regarding the confidentiality and security of research data must all be documented in an informed consent. So if you follow these safeguards, the good thing about it is that if something bad happens, like let's say your computer is stolen or someone breaks into your lab and steals paperwork or documents, that at least you can say that you followed all these safeguards and it is not really your fault that it was stolen. So that is also an important thing to keep in mind that if you follow protocol and something bad happens, then you, at least if you have to report it, you can always say you follow protocol. Then every person involved in your projects, like every scientist, needs to be trained according to the Collaborative Institutional Training Initiative. And this is required for all researchers. If you did this before 2009, you have an actual certificate and you can upload this document. After 2009, all personnel working with PHI are mandated to complete the online CIT training modules. I put in the website here on top, and basically if you go to the website, this is what you see. You can use your username and password to log in and go to the training modules. If you have never done this before, you can create that username, and you can, that's here, create an account. And basically a common problem is that you need a university ID number to create one. If you are outside the United States, then basically you can actually come up with your own number. We tried that out, and basically you can create an ID number as long as you say, well, we're affiliated with, let's say, UCLA, then you can still create your own account. This is how that looks like here. There are certain training modules that need to be completed. Here, this one, here you can see that if you still need to complete the module, human research, biomedical research, and staff, here it's not yet started as an example. So you create those modules, and then if you click on it, then you have a couple of hours of training and quizzes that you need to complete, and then you can actually print out your record that we can always use for our records actually. So I'm going to say something about the Institutional Review Board. The Institutional Review Board of a university or hospital is required by federal regulations to review all human subject research activities. The IRB is a committee that has been formally designated to approve, to monitor, and to review all biomedical and behavioral research that involve human subjects. And the IRB is also known as an independent ethics committee, ethical review board, or research ethics board. So the IRB reviews all protocols and related materials, often conducting some form of risk-benefit analysis in an attempt to determine whether or not the research should be done. And another important key goal of the IRB is to protect the human subjects from physical or psychological harm. So that's in addition to the safety of the private information. They also actually look into whether any physical or psychological harm is being done. In a typical protocol of the IRB, it looks actually very similar in terms of personnel. It looks very similar to actually a grant. You have a principal investigator that is responsible for the whole project. However, the principal investigator may designate up to 2 co-PIs, co-principal investigators, and a PI proxy. The co-PI assumes the responsibilities if the PI is not available. But basically, the PI is always responsible for everything, for all the safety issues and for the project. But if the PI is not available, the responsibility automatically goes to the co-PI. Then you have a study coordinator that is typically a key member of the research team who manages the daily activities. Then you have the co-investigators that are substantially contributing to the scientific design. And then you have the research assistants that supervise the performance and experimental procedures. One thing that is very important, and I highlighted it here, is that the principal investigator is responsible for the study safety of the human subjects and the protection of the PHI. If there is a breach, it will go to the PI, basically. Every protocol in an IRB requires a data safety monitoring board, and that is more like so principal investigators of all clinical trials or clinical research that poses greater than minimal risk need to address the following in their progress reports, and that is your DSM plan, your data safety monitoring plan. That is part of the IRB. The IRB looks in this data safety monitoring plan, and this needs to be yearly updated and reported. It's a summary of any issues that have occurred, and within any change of the protocol, that all needs to be incorporated in this DSM plan. So I just want to end with a take-home message. Make sure that all your investigators in your team are familiar with the HIPAA privacy rules and the definition of protected health information, and also, and that's very important, how to de-identify the medical patient information for research. Um, Ensure that all research proposals and protocols involving human subjects and or medical patient information is reviewed and approved by your IRB, and ensure that all investigators in your team who will work with PHI are trained and certified by the CITI modules, and ensure that all investigators in your team who will work with PHI are reviewed, approved, and included into an approved IRB protocol. So if you do these items, then I think not much can go wrong, and whatever breach will happen, at least you follow protocol. And I just want to end with a couple of internet sources where you can look up all these jargons that we discussed now. And this presentation and the slides will be available, I think, from Brian, and you can look into everything. If you have any questions, just email me or like ask me now. And I think if there's one thing that is important is that slide with the 18 identifiers that need to be removed. Thank you.
Thank you, David. That was a great presentation, and thank you for being able to present on such a short notice. So I actually have some questions. So how do we, in terms of determine who has to take this training, how do you define who works with patient health information, who doesn't? So we have a large project like the Jackson Heart Study, and our whole BUK center is involved in it. Which of those people are considered to be working with patient health information?
I think it depends on, the PI can determine that actually, because the PI is the responsible person. But me personally, I prefer that every person who is involved, every new person would do that training and would do all the modules. And that's actually, everybody here has done it actually. And I think that's the safest way to keep it safe. But to really answer your question, it's the PI that determines that. But in our case, everybody has done it, so we're safe.
Okay. Thanks. Are there any other questions from the audience?
I had the same question as you, and I will send a list of people who need to take the test on our side.
Thanks, Henning. And you know the drill now. You can just create your own university ID number and just use UCLA. We did this before, I believe, over the Skype.
Yeah, I know how to do it, but I'm going to put them into contact with you so you can give it centrally if something has changed or so.
Yeah, no problem, Henning. And I recommend that every person just does the training modules. That's the best way. Then there's no.
That's why I'm saying this now, because so far none of them has had any contact. But I agree it's probably the safest, and let's just do it. So I sent you the names.
Yeah.
Okay, thanks.
Thanks, Henning.
Any other questions? Okay, if not, thank you again, David. And next week we will have Benjamin Good presenting updates from GeneWiki, Branch, and Knowledge.bio. So thank you, everyone, for attending today's conference. And I'll remain briefly on the line if you guys have any more questions. So thank you again, and everyone enjoy the rest of your day.